All right, we're back, and our first guest is Dr. Sean Keem from Polyclinic, an orthopedic physician. We're talking about spinal conditions, spinal fractures, and spinal issues that, the likes of which have kept Tony Romo of the Dallas Cowboys off the field off and on for the last several years, and it's something that not just NFL quarterbacks go through. Here's Shannon O'Kelly and his conversation with Dr. Sean Keem.
Dr. Keem, welcome. How you doing?
I'm doing well. How are you, Shannon?
I'm doing awesome. Hey, tell us about your practice. You're a spine specialist. Give us a history on your training and your interest in the spine.
Well, I don't know how far you want me to go back, but I grew up in Santa Barbara, California, and I attended school at University of California in Santa Barbara. I earned my medical degree at University of California in San Diego, and I did my orthopedic training at Rutgers University in New Jersey. And I did my spine training at Lakewood Orthopedic Clinic in Denver, Colorado. And I practiced in Atlanta, Georgia for 13 years. And 3 years ago, I moved to Seattle, Washington, and I'm working with Polyclinic at this point.
At the Polyclinic, you're well-traveled. You should write a travel book. I mean, you've been all over.
I've been thinking about that.
Yeah. So you in your bio, you talk about minimally invasive spine surgery. I think they say MIS.
Correct.
What is that?
Basically, minimally invasive spine surgery is doing a spine operation, achieving same goal as traditional operation, but through minimal tissue dissection. So the advantage of that is quicker recovery and less pain for the patient who undergoes surgery.
Okay, so just so our listeners can appreciate what we're talking about here, when you're going in to fix the spine, do surgery on it, doing it minimally invasive style, you have less muscle, tendon, ligament disruption, less pain, swelling. The patient recovers way faster, and everybody's happy.
Correct, and less blood loss too, which is
blood
very
loss.
important.
Okay, and you do this through a scope, so you're actually doing the surgery with instrumentation now?
I do this under microscope and endoscope and arthroscope, so a lot of scopes.
You know, I have to ask, because I'm sure our listeners, I have to ask, how do you learn to do this stuff? I mean, really, what do you just show up at a weekend course? I mean, tell us how you learn and the intense training you go through to operate on someone's spine.
I think important thing is you maintain the desire to learn the new things all the time. And during my fellowship, I trained in minimally invasive surgery, but there are new stuff coming in every day. And if you just sit back and be complacent about your ability, you're never going to be able to progress. So every day I attend the conference, I read books, I read magazines, I write journals. I try to keep up myself with the most current updated information in minimally invasive surgery.
And this is what you practice, and this is your specialty. So you're treating backs and doing surgery on backs pretty much all the time?
Neck and back, Shannon.
Neck and back, okay. So we're talking about the cervical portion of the back, thoracic and lumbar, the whole spine.
Correct.
Okay, I want to ask you and talk to you about Tony Romo, okay? He is a quarterback. Everybody knows him. He's with Dallas Cowboys. He was injured here, I believe it was in Seattle, at a preseason game. He has a history of some back problems, but this was a unique injury. If you look on a video and replay, he goes down in a seated position with a compression-type injury. What happened to Tony Romo?
Now, I have to confess that I'm not a huge football fan.
Okay.
So actually, I had to watch the video and be prepared for this interview. So I think what happened is, this happened about 13 minutes into the first quarter of the game. Tony Romo, you can see him trying to dodge the attack from the defense back. And he kind of staggers a little bit. And then you see this big man, Averill.
Uh-huh.
And he attacks him he tackles from the back, which is perfectly legal, I understand.
Right.
And brings him down to the ground. And Tony Romo goes down in flat spine and hits the ground hard on his buttock. So what happens is this big man, Cliff Averill, who weighs 260 pounds, puts a tremendous pressure on Tony Romo, who's also a big man, who weighs about 230 pounds. This combined weight is all concentrated on the spinal column. And because his spine was flexed as he went down, it puts tremendous pressure to the front part of the spinal column. And then front part of the spinal column buckles and cracks under stress. That's compression fracture.
Okay, we were just talking about this awkward kind of two-force tackle that Tony Romo sustained. You were talking about a flexion injury and also a compression. which causes a fracture in the vertebral body. But our listeners are going, what is the vertebral body? So maybe talk about the vertebral body and the anatomy of the spine.
Of course. By the way, may I compliment you? You've spoken like spine surgeon. Yeah. The flexion and compression.
Yeah, there you go.
Well, that's great, Shannon.
Yeah.
Well, anyway, vertebral body is also known as spine bone. It's shaped like tuna can. So imagine there's a tuna cans that are stacked on top of each other, and that makes up spinal column. There are 7 of them in the neck, known as the cervical spine, 12 of them in the mid-back, known as the thoracic spine, and there are 5 of them in the low back, known as the lumbar spine. And all those spine segments has a names designated to it. For instance, low back has 5 spine segments. It is called first lumbar vertebra, second lumbar vertebra, and so on and so forth. And we call that L1, L2, and an L3, because if you try to say first lumbar vertebra, it's kind of, it's possible, right? Yeah. So basically, it's each component of the spinal column. That's a vertebra, spine bone.
So, when you think about a compression injury or a compression fracture, I mean, people, I think, just listening, we're used to seeing bone like, we give the dog a bone, right? It's hard, but in a healthy bone or living bone tissue, it's like honeycomb. Describe it as a surgeon, if you can, how it becomes compressed and fractured.
That's a very good question, because there are 2 types of compression fractures. One is traumatic compression fractures. One is also known as senile compression fractures. Traumatic compression fractures is what Tony Romo sustained. It is very, very dense bone. Tony Romo is only 36 years old. He's a quarterback. He's a highly trained athlete. His bone is very, very dense. So for the bone to fracture, break, it requires tremendous amount of the force. Now, senile compression fracture is different animal. Now, this occurs to elderly individuals whose bone is sort of like honeycomb. It doesn't take a lot of force to break the bone.
Okay, good point. Now, how do you treat this, and how do you fix it, or do you have to fix it, or is it just time?
Again, it depends what kind of bone the person has. Okay. Let's say Tony Romo's case, the bone is very dense, so even with the compression fractures, the deformity is not that bad. And also, the spine is not that unstable. So first line of treatment is doing no surgery. Bed rest, pain medication, brace, maybe some physical therapy if it is necessary for about 8 weeks or so. And then as long as the pain gets controlled and the deformity doesn't progress, then you don't do anything.
So let me ask you, when you say deformity doesn't compress, so in a compression fracture, what you're looking at, when you look at x-rays or an MRI, you want to see if that vertebral body is fragmented or displaced?
When you look at the x-ray, you can see the front part of the vertebral body is compressed, shorter in the height than back part of the vertebral body. So it is not really fragmented. It's sort of like it gets crushed, like soda can, like tuna can, you step on it.
Right. Good stuff. How would we get more information on your practice? You're a spine surgeon specializing in treatment of cervical, thoracic, and lumbar spine problems. Can you give us a phone number or a website?
Sure. You can find me at the polyclinic.com, and there's me, and I have a sub-segment within polyclinic.com. And if you have any inquiries, please call me.
Thank you for your time. Great information.
If you'd like more information on this topic, as well as how to contact Dr. Sean Keem, go to polyclinic.com or irgpt.com and click on the Health Experts tab.